Rebecca Jirakoske. I'm going to talk about effects of COVID-19 on globalization and industries. When COVID-19 hit back in 2019, late 2019 and all the way to 2020, so much really happened in the world, which affect globalization, nations, industries, and how people operate, how individual operates, families operate, and how we carry on our daily lives. So during this period, so much was taken in, so much was implemented for us to adjust to the new norms in the life that we had to lead from there on. So corporations and governments had to sit and discuss on fast ways of going to cope to the new changes in this world, and corporations and had to change into new technologies. They had to change to people working from home and operating in a different way. So many people who had the knowledge on technology were employed. People had to adjust to the new changes. People working from home, and they had a way of doing things. And also there was an issue of industries. They started depending on the supply chains from within their countries and reducing the import of stuff from other countries, which encouraged the wide range and use of our own products from our own countries. Also, global pandemics also in terms of supply chain management practices also across industries increase. It brought in more opportunities, more people being more creative on supplies, on getting new things, on how to supply products in the countries, which also had to create employment for people. And also governments and localities reevaluated the worth of local industries and tightened the immigration regulation in response to the uncertainties. So the movements from one country to the other was also reduced, and also in this essence it brought the inequalities now between nations were lowered, or it was lessened, now that every country could stand on their own and do things on their own. Also, during this period of COVID-19, medical treatment had been entirely disrupted in most of those nations. According to that time, the outbreak interrupted production while increasing consumer demand, relying major global healthcare supply chain vulnerabilities. Throughout the outbreak, during that time of outbreak, supply chain or management depended increasingly on public-private partnerships and to assist statewide reliable operations. Actually, numerous organizations employ this method to cover the funds from government programs, since that individual organizations were not able enough to provide medications, so they had to be funded by these big organizations like World Health Organizations. The United Nations had to fund majorly those countries who were unable to raise the amount to feed their people, to put people on medication. So despite these various disadvantages, someone argued that some had positive outlook resulted from this COVID-19. Also, it brought core cutting-edge technologies like particular telemedical medicines, which was still used to utilize due to COVID-19. Also during this time, according to the tourist industry, which has lost much money due to the antivirus, so now that there wasn't a movement from one country to the other, it affected those tourism, for especially the international. Now it had to promotes local industry or local tourism that allowed people in the countries to move from one province to the other, from one county to the other. So it promoted those local tourism, which was good for the country and people to learn more about their country. And also, therefore, I would say COVID-19 has become a worldwide health emergency with substantial economic repercussions, actually, and it has brought more awareness, and it has also encouraged people to be more cautious and to look forward to the future, knowing that anything is possible. A lot can happen with a span of a short time. The pandemic has also highlighted the vulnerability of global supply system, the danger of international travels, and it has allowed so many people to adjust to the new systems in our countries. And we've learned a lot as a country. We've learned a lot as a society, and with it we also learn to mingle with people, to be within families, and focus on health. And with it also we learned that health is very important. We learned that a country cannot run without their own people, and it is also a way of teaching us that with it so much could have happened in a short span of time. And COVID-19 affected a lot, and it also meant a lot to people and how life operated and how things were done. And it has prepared people for the future, and now we can handle things in a proper way.